Good afternoon. I'm Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, September 24th, 2021. It's time for our weekly COVID update. We've talked about over the last few months and weeks and even last year, just thank yous. I want to give a couple of thank yous out today. And one of them is previous JP, K. McNutt, a couple of weeks ago, about 2 months ago, when we had an issue with just testing and stuff like that. We talked about it here on our Facebook Live, and she called me that afternoon and had some opportunities for us and found some tests if we needed it and did that. And I just wanted to, I never said that next week thank you to her, and I just wanted to make sure I got that out. And it's, man, thank you to the entire community. When we've used this forum to put that information out or even things, people have contacted us in all kinds of ways. And I just want to say thank you. We've been successful over the last 18 months in COVID-19. When I say we, I'm talking about Mount Pleasant, I'm talking about Titus County, and I'm talking about Northeast Texas. We've done some great things, and I just want to say thank you. Before I get into the COVID numbers and talking about where we're at, I want to give a shout out to our second floor neonatal team. Titus Regional has about between 950 and 1,000 babies a year. I'm trying to get the numbers, but I think we're the most babies delivered on an annual basis of any rural hospital in the state of Texas. That's a lot of babies. And we have a phenomenal team, both on the OBGYN side and on the pediatrician side from physicians, great physicians. But we also have a great clinical staff and nursing staff. And we're a level 2 neonatal unit, or NICU. This Tuesday and Wednesday, we had the opportunity to have a survey. And we had that survey done 2 years ago. It's done this year, and now it'll go every 3 years. But our team did a phenomenal job. And I just want to give a shout out to everybody involved in the second floor, both the clinical staff and the physicians for the work that they did. They had zero deficiencies, which in healthcare is unheard of. But it was just a great job of planning and what they're doing in the community. And what I'm most excited about is not what they've done, but what they're planning to do for the future. And they're driving a lot of Healthier Tomorrow initiatives in our neonatal space for the future. So we're excited about that. So congratulations to everyone involved with our second floor and everyone who's had a baby here over the many years as well. We appreciate you trusting our health system in that beautiful part of your life. So when we talk about COVID, we talk about the fourth surge. From a Titus Regional standpoint, today I come with it's hard. Come with good news and good signs, and at the same time, a little intrepidation of a few things, and just want to make sure we're honest and transparent the entire time. Today, we're sitting at 14 patients, with none sitting in the emergency department. That's great news. That's the lowest we've been in quite a while. 7 on the COVID floor, 7 in ICU. My intrepidation is just that, 7 in the ICU. Our ICU is still full. We have sick patients, and we've had sick patients come in this week, so it's not like it's 6 patients that have been here for a while. We've had sick patients. We have young patients that are fighting for their life. And I guess that's what I just want to celebrate and warn you at the same time. Celebrate the numbers are going down, and we're doing some great things, but warn you as well that we are still finding young people who are fighting for their lives that we can prevent. And just want to encourage you to do everything you can. From a region's perspective, you can see over the last week, significant declines from 209 hospitalized patients to 182 as of today. The ICU has gone down from 69 to 64, so only 5. So we talked about that in the last few weeks. So it's interesting that our sicker patients are still there. There's fewer of that mid-range that are sick just needing the hospital. That number is starting to come down. So that's a good sign, and it's consistent with what you're seeing across Northeast Texas and in Dallas. This is the Tyler area. Same thing. You can see 755, 760 down to 702. ICU beds down a little bit, but not a lot. So they're still having some really sick patients in that area as well. And this is the Dallas region. Same trend as well, same percentages as well. ICUs come down a little bit more in the Dallas area, which is a beautiful sign for a lot of us. But the one thing I just want to encourage us to remember, this is still a dangerous virus. And as we move into the fall, and I loved having the cool weather. This makes me so excited when we get to the fall weather outside. But just keep remembering the things that we need to do, to wear our mask, to vaccinate, to social distance. Those are important steps as we continue to live our lives, but we do it in a healthy way. And I would encourage you, if you get sick, do not wait. If you start showing any signs, get tested. Get to a primary care physician. And there's things that we can do to help you and things that we're seeing on a consistent basis. And one that we're seeing is monoclonal antibodies. Last week I kind of misspoke when I said they stopped making it. I meant to say stop distributing. And really from a company standpoint, they're not distributing the monoclonal antibodies even more anymore. 70% of the nation's supply, the antibody treatments, were going to 7 states, and Texas is one of them. Titus Region was one getting a lot of them for our size health system. So it was important last week when I put that out there, and I was concerned about what's going to happen from the state. And when I left here, I found out we were at a 0, and we weren't going to get in this week. And we worked with the state, and I just can't thank the state enough of listening to what we're doing, understanding the challenges in the region, and they stepped up and made sure we had plenty of shipment this week. They got 192 doses this week. We're able to continue. As you can see, our treatments over the last week, we've stayed at that 17, 18 per day. We've come down to 10 and 15 the last few days. I'm looking at the Regeneron. Sorry, get a little fast when we put data up there. I love this stuff. But the Regeneron's the one that we're looking at, and that's the one that matters for the outpatients. And going down to 9 yesterday was a good sign, and I hope it'll continue to go down because that means we're getting better in the outpatients standpoint as well. But the state did supply more. It's on a week-by-week basis. We're continuing to do the things that we feel necessary to get the weekly shipment, so we're excited about that. But just thank everybody for asking me the questions last week and keeping us honest on making sure we are saying what we mean on a weekly basis. The booster's been interesting this week, and the booster, we've talked about the 3rd shot, but now we're talking about the booster. And right after this meeting last week, somebody put on our message board that I watched during our podcast, our information here, and it was interesting that they met and approved a booster. And it was really a committee that was meeting last Friday, and they made a recommendation. They actually didn't include a booster for everyone, but just a booster for Pfizer for 65 and older and high risk. That would go to the CDC and the FDA this week, and more to come. Well, yesterday there was an announcement that came out that they did not take the panel's recommendation, and they put the booster out there for more number of people. So for teachers, for education, will be a part of that high risk. There's more to come right now. Pfizer is pushing the booster. The majority of Northeast Texas around here received Moderna in January, February. So that's what we're waiting to see, Moderna, over the next couple weeks and what that does. But from a health system perspective, we meet with our doctors on Monday. We'll continue to work with our doctors and take advice on how do we proceed. We're watching the boosters closely. As soon as the booster is ready to go and we have all the definitions of who should get it, we'll get that information out there, and we'll get that to the Northeast Texas and Mount Pleasant area. We're continuing to work in our vaccine clinic. It's open Monday through Thursday from 7:30 to 1:30. Tuesdays at 7:30 to 7. We're doing a clinic tomorrow and helping out one of the churches in town. Michelle and her team were at Harts Bluff this morning doing more vaccines. They went to one of our retirement communities in town this afternoon to give vaccines as well. So just that team's doing a great job of just getting that vaccine out there. And you see it in our numbers. This is Monday, so I update it each Monday. But you can see the region's still saying at 47% first dose, 39% second fully vaccinated. Titus County is almost at 51% now, and that's a huge win. Now, the state's at 70%. So if say it's a huge win, people are going to look at me like I'm crazy. But we came from behind on this one, and it took us forever to get the vaccine to the community. And once the state did, the community's done something with it. So we got work to do. We're about at 40% fully vaccinated. We're continuing to increase that number. So I'm excited to see where that will go. But we need to continue to work on the vaccine. Next week, we're going to have our Titus County Fair. And I've got a catch-22. I'm just nervous. It is outside, which is the best thing about it. It's outside. But what we are going to do next week at the county fair is we're going to have a vaccine place. Anybody wants to get the vaccine while they're at the county fair, Michelle and the vaccine team will be there. You can grab you a corny dog, grab you a funnel cake, grab you some lemonade or sweet tea. Come inside, get your vaccine, sit for 15 minutes while you eat your corn dog. Corn dogs and vaccines just seem like they should go together in Titus County. But the Titus County Fair will be next week. It's an exciting time. We've been here for over 18 years now, and it's still fun when the fair comes to town. Even when the kids get older, it's still fun to see everything goes on. But we will have our vaccine clinic there. I would encourage you, if you're indoors, to wear your mask if you're really close to people, and just disinfect your hands and wash as much as possible. But we are excited about the fair coming to town, and the vaccine clinic will be there. I want to continue to thank our team and everything they're doing on a daily basis, and I want to thank the community for your support. Even though the numbers are going to increase, we're going to still keep getting information out there. We'll still keep doing our Fridays just to let you know what's going on, to make sure we're trying to stay ahead of this on a weekly basis. On behalf of the team here at Titus, I want to thank you for your support. God bless.